Tell me about Botox, because I think there's a lot of misconceptions, and even myself, I don't know exactly what it is. What is Botox?
I'm thrilled to talk about Botox. It's a product I use and a product I really like. And I just gave a talk at the office for my staff, and I entitled the talk, Botox, the Beauty and the Bunk, because there is so much bunk out there about Botox. Botox is a purified protein that's derived from the microbe that produces botulism. And botulism is well known to most people who are around in the 50s. It was the disease that happened when cans got in. Botox isn't botulism. It's a purified protein derivative from a similar microorganism. That protein is completely purified and flash frozen. So when it's sent to me, it's in a tiny vial. It actually has a hologram seal on it so that you can't accept any false products there. You can identify the hologram. And the protein has been measured as to its activity. So I know exactly how much strength I have in each syringe. Botox works as a molecule that hangs up the phone between a nerve and a muscle. So when I talk to patients about it, I say, think about your teenager. You still have a teenager, you still have a phone, you've just broken the connection. And so in your face, when you're using Botox, you still have a muscle, you still have a nerve, you've just hung up the phone between the two of them. That's really important to patients who are experimenting with Botox the first time. They want to know that they're not going to do anything permanent, they're not going to do anything irreversible. And to me, that's what's great about Botox. If I thought that when I highlighted my hair it would have to be that color till I was 80, I'd be petrified to do it. It's great that Botox lasts 3 to 4 months and then it goes away. It's a world of forgiveness. You can get a treatment, alter it, change it, or stick with that treatment forever. And you don't have to feel like you're doing something that's permanent.
Where do you use it around your eye? Where would you put it?
The most common place to use Botox around the eye is for frowns right in between your brow. Frown lines or scowl creases. That's the most common area. A lot of patients form those scowl lines as youngsters and don't even mean to be scowling anymore, but they do. And those lines change how you're perceived. You might seem angry when you're not. And when you use Botox, you actually give the injections into the forehead area. It's a tiny amount of injection we put in on with a tiny needle. And the protein immediately sits on the telephone between the nerve and the muscle and stops you from scowling. By stopping scowling, the wrinkles naturally fade. So really, it's the most natural treatment you can have for the elimination of wrinkles. I use it somewhat in the crow's feet area, around the outer corner of the eye, although not too much in this area. I'm 50% Irish, and I think in almost all the homes in our family, there's that little embroidered plaque that says Irish eyes are smiling. Your eyes should smile when you smile. A woman's face should show her heart. That's part of what makes us different. That's part of the beauty of a woman, I think. So when patients come to me for Botox, I try to be really goal-oriented. Let's talk about what's really a problem area. Let's change that area. But let's let you and what's in your heart shine through.
So when you see these faces in Hollywood that look like they have no expression, they don't move at all. So if Botox is done correctly, then you don't look like that.
That is right. That, to me, is a loss. It's a loss of the person. And I think that when Botox was first being used, surgeons didn't know to be as judicial with it as they are now. It's really important to use it sparingly, use it in a problem-focused way, and let the face dynamically move. Absolutely.
And along with Botox, we hear about fillers. What are fillers? Is it the same thing?
It's not the same thing, but they work together synergistically. I tell my patients, Botox is a diet, fillers are a girdle. If you really want to fix the problem, you've got to take the weight off. But if you need some instant gratty or something to help you through that clingy red dress, a girdle will help you too. So if a patient says, I want to spend the least amount of money or do the least amount of interventions on my face, but these wrinkles are really a problem for me, then I recommend we stick with Botox. If a patient comes in, maybe has a little bit more money to spend and says, I want this wrinkle really gone, but I also need it to look a lot better tomorrow, they're going to do Botox and filler. What the Botox does is it helps us stop folding the skin, and the skin will naturally start to lay flat. What the filler does is fill that crease so that it lays flat immediately. The The filler that I'm using predominantly right now is Juvederm. It's a thin, clear, colorless, odorless substance, kind of like a gel toothpaste. When you feel it in your hand, it feels like a gel toothpaste. And that's again placed just underneath the skin to plump up a wrinkle and give you just a world of forgiveness in a half an hour. So different than Botox, but complementary and even synergistic.
So there's different kinds of fillers, and you choose Juvederm. Why do you choose Juvederm?
Two reasons I choose Juvederm. It's a good question. Juvederm comes in two different thicknesses. So depending on where I'm injecting it into the face, I can choose based on either the location or the patient's skin type, whether they need a thicker Juvederm, more on the consistency of kind of a cold honey, or whether they can go with a thinner one like corn syrup. I chose Juvederm really because the price point is a little lower. A lot of my patients don't want to spend $1,500 on a filler, and some of the other fillers really run in that price range. So Juvederm is a little bit more cost-effective for my patients who are generally juggling lots of things in their checkbook and don't have an unlimited resource to improve their appearance.